Hello and welcome to this short webinar on Medicare speech therapy basics. My name is Zachary Edgar and my company is called Therapy Comply. Therapy Comply is a membership-based compliance firm dedicated to assisting physical, occupational, and speech therapy practices and facilities. Members can access a wide selection of guides, sample policies, and forms on Medicare, Medicaid, HIPAA, TRICARE, and state rules and regulations that apply to therapy practices. Members can also email me at any time with any compliance or billing questions or schedule a phone call. Please visit our website at therapycomply.com for more information. This presentation is for informational purposes only. None of the material is intended as legal advice. Statutes and regulations are all subject to change. Speech-language pathology services are those services provided within the scope of practice of SLPs and necessary for the diagnosis and treatment of speech and language disorders which result in communication disabilities and for the diagnosis and treatment of swallowing disorders, dysphagia, regardless of the presence of a communication disability. A qualified SLP for Medicare coverage purposes meets one of the following requirements: the education and experience requirements for a CCC in speech-language pathology granted by the American Speech-Language Hearing Association, or meets the educational requirements for certification as in the process of accumulating the supervised experience required for certification. Services of speech-language pathology assistants are not recognized for Medicare coverage. Services provided by SLPAs, even if they are licensed to provide services in their states, will be considered unskilled services and denied as not reasonable and necessary if they are billed as therapy services. Services provided by aides, even if under the supervision of a therapist, are not therapy services and are not covered by Medicare. Although an aide may help assist the therapist by providing unskilled services, those services are not covered by Medicare and should be denied as not reasonable and necessary if they are billed as therapy services. Evaluations. The SLP employs a variety of formal and informal speech, language, and dysphagia assessment tests to ascertain the type, causal factors, and severity of the speech and language or swallowing disorders. Although hearing screenings by the speech-language pathologist may be part of an evaluation, it is not billable as a separate service. Reevaluation of patients for whom speech, language, and swallowing were previously contraindicated is covered only if the patient exhibits a change in medical condition. Monthly reevaluations, for example, a Western aphasia battery for a patient undergoing a rehabilitative speech-language pathology program, are considered a part of the treatment session and shall not be covered as a separate evaluation for billing purposes. I apologize in advance for butchering many of these words. The following are examples of common medical disorders and resulting communication deficits which may necessitate active rehabilitative therapy. The list is not all-inclusive. Cerebrovascular disease such as cerebrovascular accidents presenting with dysphagia, aphasia, apraxia, and dysarthria. Neurological disease such as Parkinson's or multiple sclerosis with dysarthria, dysphagia, inadequate respiratory volume control, or voice disorder, or laryngeal carcinoma requiring laryngectomy resulting in aphonia. Auditory processing evaluation and treatment may be covered and medically necessary. Examples include but are not limited to services for certain neurological impairments or the absence of natural auditory stimulation that results in impaired ability to process sound. Certain auditory processing disorders require diagnostic and audiological tests in addition to speech-language pathology evaluation and treatment. Assessment for the need for rehabilitation of the auditory system may be done by an SLP. Examples include, but are not limited to, evaluation of comprehension and production of language in oral, signed, or written modalities, speech and voice production, listening skills, speech reading, communication strategies, and the impact of the hearing loss on the patient and their family. Examples of rehabilitation include, but are not limited to, treatment that focuses on comprehension and production of language in oral, signed, or written modalities, speech and voice production, auditory training, speech reading, multimodal, visual, auditory, visual, and tactile training, and communication strategies. Dysphagia, or difficulty in swallowing, can cause food to enter the airway, resulting in coughing, choking, pulmonary problems, aspiration, or inadequate nutrition and hydration, with resulting weight loss, failure to thrive, pneumonia, and death. The SOP performs clinical and instrumental assessments and analyzes and integrates the diagnostic information to determine the candidacy for intervention as well as appropriate compensations and rehabilitative therapy techniques. Swallowing assessment and rehabilitation are highly specialized services. The professional rendering care must have education, experience, and demonstrated competencies. Competencies include, but are not limited to, identifying abnormal upper air digestive tract structure and function, conducting an oral, pharyngeal, laryngeal, and respiratory function examination as it relates to the functional assessment of swallowing, recommending methods of oral intake and risk precautions, and developing a treatment plan employing appropriate compensations and therapy techniques. Speech-generating devices are considered to fall within the durable medical equipment benefit category. They are covered for patients who suffer from severe speech impairment and have a medical condition that warrants the use of a device based on the following definitions. Speech-generating devices are speech aids consisting of devices or software that generate speech and are used solely by the individual who has a severe speech impairment. The speech is generated using one of the following methods: digitize audible, verbal speech output using pre-recorded messages, synthesize audible, verbal speech output, which requires message formulation by spelling and device access by physical contact with the device direct selection techniques, synthesized audible, verbal speech output, which permits multiple methods of message formulation and multiple methods of device access, or software that allows a computer or other electronic device to generate audible/verbal speech. Non-covered indications: internet or phone services or any modification to a patient's home to allow the use of speech-generating device are not covered by Medicare because such services or modifications could be used for non-medical equipment such as standard phones or personal computers. Specific features of a speech-generating device that are not used by the individual who has a severe speech impairment to meet his or her functional speaking needs are not covered. This would include any computing hardware or software not necessary to allow for generation of audible verbal speech, email, text, or phone messages, such as hardware or software used to create documents and spreadsheets or play games or music, and any other function a computer can perform that is not directly related to meeting the functional speaking communication needs of the patient, including video communications or conferencing. Thank you for watching, and please visit the website at therapycomply.com for a lot more comprehensive information on physical, occupational, and speech therapy compliance and billing. Please like and subscribe. We'll be adding more videos soon.